I'm Dr. George Alexander, consultant gastroenterologist working in Mediclinic Dubai. Today I want to talk to you about fatty liver disease, also called non-alcoholic fatty liver disease. Fatty liver disease is a spectrum of liver disease characterized by the presence of excess fat in the liver, which cannot be explained by the presence of alcohol consumption. This is a very common and highly prevalent disease throughout the world. But unfortunately, it is highly misunderstood and people don't realize the seriousness of this disease. Fatty liver disease severity ranges from simple fatty liver, which fortunately is the most commonest, to the more advanced non-alcoholic steatohepatitis, in which the excess fat leads to liver damage and hardening of the liver, that is liver fibrosis. This is a reversible condition, but if untreated, it can progress to end-stage liver disease and liver cirrhosis in a minority of people. There is a strong association between advanced fatty liver disease and the presence of risk factors like diabetes, hypertension, obesity, and presence of high lipids. Coming to the diagnosis of the disease, unfortunately, there is no specific symptoms in this problem, and one has to suspect the presence of fatty liver disease in the presence of the associated risk factors. Common tests like ultrasound can pick up the presence of fatty liver, and you can do a liver function blood test in these people. But to know more about the severity of the disease, the most useful test is a fibro scan. This is a non-invasive test which is similar to the ultrasound but gives us more information as to the amount of fat in the liver and the amount of liver damage and fibrosis. Coming to managing the disease, the most important aspect is to manage the risk factors like diabetes, hypertension, obesity, and hyperlipidemia. Medications like vitamin E as statins are useful in managing the disease, but the most important aspect is controlling the risk factors. Therefore, reducing the weight by diet and exercise is the most important component in managing the disease. So finally, let me conclude by saying that fatty liver disease is a highly prevalent disease but is commonly misunderstood and not taken seriously. In a small proportion of patients, it can progress, leading to liver damage and its serious consequences. Therefore, picking up the disease early and starting treatment is very important to prevent disease progression and its complications. Thank you.